Hi guys, and welcome to today's coffee chat. Up to right now, I've not had to have my knee replaced. I know lots of people that have gone through the knee replacement process. Some of them have had one knee replaced, some both. Some young people, middle-aged people, and older people. But the one thing that they all have in common when it comes to a knee replacement is they tell me it's tough, it's difficult, it's painful. It requires a lot of discipline if you're going to get that knee working again. It would be a shame to go through the surgery, have the knee replaced, and then not do the PT and the exercises that come afterwards. You'd just be stuck with a knee that would be straight out just like that. And that wouldn't be functional at all. So you've got to go through that painful process of working that knee so that you increase the degrees of influence. The gold standard, most surgeons and physical therapists will tell you, is after knee replacement, you want to try to get your knee to bend at 120 degrees. Man, that sounds almost demonic, 120 degrees. I'm not even sure my knees will bend at 120 degrees, and I've not even had a knee replacement. But if you think of zero bend being like this, and maybe 90 degrees being, like an angle like that, or 120 being like that, this is the standard that you want. And in order to get there, you have to work hard at it. It's painful. You've got to be committed to the process. You've got to be disciplined. Every day, you've got to do your exercises. You've got to bend. You've got to work your way through the pain in order to achieve the goal that you want. Because doctors will tell you, if you can get it back to 120 degrees, hey, you can probably do just about anything that you were able to do before. And that's exciting. And maybe that's worth all the pain in the process. Well, you may be asking yourself, well, what does this have to do with me? What does it have to do with you? What does it have to do with the coffee chat today? Well, there's lots of things in life, kind of like knee replacements, that are tough, that are hard, that you have to do the hard things in order to get through them. It may involve suffering. It may involve some pain. It may be trying to recover for something. It may be trying to reach a goal. It might be trying to make a change. I'm not sure where you are in your life right now, but most likely, just like me and many of my friends that I know, we've got some tough things that we have to do. And in order to do that, we have to set our minds clearly on the goal. And we have to keep that in the forefront of our mind all the time in order to achieve it. It may be weight loss. It may be increasing your exercise. It may be working through something, a habit, an attitude, a behavior, something that you've been trapped in for a long time. It may be some misuse of, a drug, alcohol, or other things like that. We all have our vices, and we all have the tough things that we have to work through. But what it requires is discipline and the commitment of working through that. So the one thing I want you to remember today, if you're trying to work through something that's tough, and it's so tough that some days you feel like giving up, the way not to give up, the way not to quit, the way to keep working through that, to keep bending that knee, and to get to that 120% degree, to get that to overcome, is to keep the vision alive. Keep the vision alive. Research tells us that if you can use your mind to think about the thing that you want to achieve and actually visualize you doing that before, or being at that place before you get there, or experiencing inside your mind the thing that you want so badly to achieve, if you can focus on that, if you can keep that vision in the forefront of your mind, then it will draw you to that. We are teleological people. We're drawn to things. So the one thing I want you to remember today is this, is whatever that challenge is, whatever that goal may be, whatever that relationship or the change that you need to make. Maybe it involves going to see a therapist, a counselor. Maybe it involves sitting down and having difficult conversations with people. Whatever it is, the tough thing, the thing that's hard, the thing that's challenging you, the thing that some days you feel like quitting on, to overcome that, because you can overcome it, is to keep the vision alive. We'll talk more about this as we go through the year, but I want to encourage you today to keep that vision alive. See what it is that you want to achieve and keep pressing toward it today. That's my encouragement to you today. Thanks for stopping by Coffee Chat. I hope you'll come back next week. I look forward to talking to you then. Until then, have a great week and keep the vision alive.